I tried putting some emojis. It seems like you guys are getting these shapes down. That's good. All right. So what is the, again, I tried to like summarize, right? Like, I think you'll start to notice that I use the same kind of tenets when I'm following or when I'm reviewing a question. I would say step one, arguably, is try to figure out what the question is asking. This is saying what's the most common cause. Okay, so that should give you a little bit of sense of what kind of your framework of mind. But I also try to summarize the question and put it into a one-liner format. So 55-year-old female with hypertension who comes in with ripping, substernal chest pain, elevated blood pressures. And again, money, where's the money at? Because chest pain can be a lot of different things. It could be MI, it could be PE, it could be a lot of things. But if somebody's having ripping, that's about like a much more specific type of characteristic. And then specifically in this case, the chest X-ray shows a widened aortic root. Then this would be suggestive of like a widened mediastinum or like aortic dissection, right? So that's not what the question is asking. The question is asking a little bit further. So what's the most likely cause? You are all absolutely correct. It's medial degeneration of the aorta. That's from long-standing hypertension, just eating away at the tunica intima, and eventually there just comes a rip. Blood flows underneath the tunica intima, gets stuck, and starts to obstruct blood flow. And that tear could go extensively. Like you can get tears from the aortic root, but then it could dissect downward into the coronaries, or it could dissect upward into your carotid and cause a stroke. So that's why it's so important that we treat these patients like immediately. Any idea? I'll give you guys a chance. Like if I could word this question differently, maybe the answer choice to ask about what would be the next best step in treatment. So do you know how would you treat these patients? Okay, all right.
Probably want to give beta blocker to slow down or to lower the blood pressure.
Yes, absolutely. So you and whoever wrote this beta blocker, you're absolutely correct. So the likelihood of the tear progressing is correlative to the heart rate. So if you slow down the heart rate, it prevents the tear from getting worse. So if you can get their heart rate as low as possible, that's better for you. Some of these answer choices might say use an alpha blocker first, like the calcium channel blocker or something like that. Avoid that because it's going to cause reflexive tachycardia, and that will also like just make the tear even worse. So, and this is the opposite, by the way, when you have a patient with pheochromocytoma. Pheochromocytoma, we usually do the opposite. Usually do alpha blockade before beta blockade.